LGB Alliance USA is a 501c3 nonprofit dedicated to protecting and advancing the rights of lesbians, gay men, and bisexuals. We would like to express our concern that Admiral Rachel Levine, MD, Assistant Secretary of Health for the United States Department of Health and Human Services, also known as the HHS, and head of the U.S. Public Health Service Commission Corps, will be a keynote speaker at the American Academy of Pediatrics, also known as AAP, conference this month. Levine claims, quote, "I am not a political person," while simultaneously asserting that with regards to gender-affirming care and facilitating easier gender transition of minors, quote, "medical professionals need to stand up and be more vocal." And that's exactly what I'm going to do. We encourage Levine and the AAP to listen to the growing number of medical professionals who are speaking out about the harms of so-called gender-affirming care. In an interview with NPR, Levine states, quote, "There is no argument among medical professionals, pediatricians, pediatric endocrinologists, adolescent medicine physicians, adolescent psychiatrists, psychologists, etc., about the value and the importance of gender-affirming care. This contradicts the evidence of growing concern among medical professionals with the practice of transitioning minors. To date, systematic reviews continue to conclude that, quote, "gender-affirming care does not resolve gender dysphoria or improve long-term mental health." In fact, the UK's NHS, one of the world's largest national healthcare systems, after conducting their systematic review, the CAS review, has gone on to issue an emergency ban on the procedure. The New York Times notes that similar conclusions have been made in other countries, reporting that Germany, France, Switzerland, Scotland, the Netherlands, and Belgium have all proposed moving away from a medical approach to gender issues. Levine overstates the strength of the evidence, stating, quote, "transgender medicine is a very complex and nuanced field, with robust research and standards of care that have been developed." In addition to reviews like the CAS review, which calls the evidence, quote, "remarkably weak," whistleblowers and concerned physicians alike refer to the methodology of this research as deeply flawed, and the practice of gender medicine on minors as, quote, "experimental." If Admiral Levine truly cares about providing quality medicine to United States citizens, then these concerns about gender-affirming care deserve serious inquiry, not dismissal. Notably, the World Professional Association of Transgender Health, also known as WPATH, considered the expert on gender medicine, appears to have received policy recommendations from Admiral Levine. Now, this begs the question, are medical policies developed by evidence-based science? Or are they influenced and developed by politics? The level of advocacy Admiral Levine shows for those seeking gender-affirming care must be extended to those harmed by this same gender-affirming care. The issue of children and adults harmed by gender medicine greatly concerns LGB Alliance USA. Those adversely affected by gender medicine are disproportionately same-sex attracted and or have underlying comorbidities that often go overlooked or ignored via the, quote, affirmation model of gender care. As an advocacy group for same-sex-oriented people, it is the duty of LGB Alliance USA to bring this dilemma to the Admiral's attention. Admiral Levine has little understanding of the needs of the LGB community. Having lived a heterosexual lifestyle, transitioning mid-40s, and subsequently becoming a member of the, quote, TQ plus community, Admiral Levine does not share the experiences of same-sex-oriented people. Therefore, Levine has no first-hand knowledge and little understanding as to why homosexuals are particularly at risk for being misdiagnosed as transgender, especially in childhood. Now, the repercussions for this misdiagnosis are at best irreversible, and at worst, deadly. We are confident that Levine can see past the popular, convenient narrative surrounding gender affirming care and listen to the concerns of an ever growing number of US citizens, homosexual, bisexual, and heterosexual, has about the issue. Will Levine prove us correct and fight for quality care in gender medicine? Or has the Assistant Secretary of Health for the United States fallen too far in the ideological capture? Or worse, is Levine the one doing the capturing?